The ICU collapsed at 2:47 in the morning. 7 patients were trapped inside. Ventilators failing, arterial blood pooling beneath twisted steel and shattered ceiling panels. At the edge of the wreckage stood the hospital's most powerful surgeon. He looked into the darkness, listened to patients calling for help, and refused to go in. Not because he was afraid, because he calculated. Liability, institutional risk, what it would cost the hospital if they lost him too. So he gave the order, no one enters. And for a moment, the entire trauma team froze. But behind him, one nurse no one ever noticed was already moving. Noor Hadid, the quiet ICU nurse written up for being too hesitant, grabbed a trauma kit, climbed over a collapsed beam, and disappeared into the wreckage alone. What she did over the next 41 minutes would save 3 lives and expose a secret the hospital had buried inside her sealed file. Because Noor Hadid was never just a timid nurse. Mercy. General always sounded different during a storm. On quiet nights, the intensive care unit hummed with a steady rhythm. Ventilators cycling in patient mechanical breaths, cardiac monitors chiming softly, nurses speaking in low, practiced tones that never carried beyond the bedsides. But when thunder rolled over the city, the sound traveled through the building itself, vibrating through ceiling panels, rattling IV poles, turning the ordinary mechanical noises into something uneasy and irregular. Just before midnight, the rain intensified into a steady roar against the windows lining the ICU corridor. Noor Hadid stood at the medication station with her hands wrapped around a plastic cup of lukewarm coffee she hadn't touched. She had been on the shift for 3 hours and already felt the familiar tightness in her shoulders that came whenever the unit was short-staffed. 2 nurses had called out sick. 1 patient had coded at the start of the evening, and a ventilator alarm down the hall had been chirping intermittently for the last 10 minutes because a respiratory therapist hadn't arrived yet to recalibrate it. She watched the rain streak down the glass and tried to steady her breathing. Across the nurse's desk, 2 senior staff members were discussing bed assignments in clipped, efficient voices. They spoke the way experienced ICU nurses always did. Fast, confident, yet decisive. While Noor listened quietly, waiting to be told where she was needed next. She rarely interrupted. That reputation had followed her since her first year. Too quiet, too hesitant, slow to speak during emergencies. It was written in her last performance evaluation in neat administrative language that still stung when she remembered it. Noor shifted her weight and glanced toward the far end of the unit, where room 12 housed a teenage cardiac patient who had undergone an emergency valve repair 2 days earlier. His monitor traced a steady line of green peaks across the screen. Beside him, his mother slept in a chair, her head resting against the wall. Everything looked stable. Then the lights flickered. It lasted less than a second, just long enough to make every monitor dim and brighten again. A few nurses looked up instinctively, but when the equipment resumed its normal hum, they returned to their work. Storm fluctuations happened all the time. No one moved. The second flicker came with a sound. A deep metallic groan rolled through the ceiling above the central ICU corridor. Not sharp or explosive, but heavy and strained, like a structure shifting under weight it was never meant to carry. Noor's head snapped upward. The sound didn't stop. It deepened, vibrating through the floor beneath her shoes. Someone down the hall said quietly, What was that?" Then the ceiling gave way. It happened in a cascade of violent, deafening noise. Fluorescent panels shattered. Metal framework snapped downward. Sections of ductwork tore loose and crashed onto the ICU beds below. A surge of dust and insulation burst into the air as electrical conduits sparked and swung violently from the exposed structure above. The force of it pushed a wave of air down the corridor. Noor stumbled backward against the medication counter as alarms erupted all at once. High-pitched ventilator warnings, cardiac monitors shrieking,
keep that line clear. Watch the
oxygen line
corners.
pressure alerts, patients
Vitals
screamed.
are dropping. We need to
Someone
go faster.
shouted, "Get them out,
Almost
now!"
there. Don't
Nurses
stop
rushed
now.
forward instinctively,
Move,
but then the
move,
floor
coming
trembled
through.
again, a deep,
that
sickening vibration that made the entire corridor feel unstable beneath their feet. "Back!" a voice yelled. Everyone back!" Staff pulled patients who were closest to the intact end of the unit into the safe zone, wheeling beds and dragging portable monitors through the haze of dust. But halfway down the ICU wing, the corridor was completely impassable. Collapsed ceiling beams and twisted metal framed a dark, jagged opening where rooms had partially fallen into the level below. 7 patient rooms were cut off. Their monitors still screamed from somewhere inside the wreckage. Within minutes, Hospital emergency protocols activated. Security sealed the corridor. Maintenance reported structural instability. Fire and rescue teams were notified, but delayed by flooded roads outside. When Chief Surgeon Dr. Roman Talvera arrived, he walked straight to the threshold of the collapsed section without breaking stride. He stood just inside the safe corridor, looking into the destruction. Dust drifted slowly in the air. A ventilator alarm echoed faintly from somewhere beyond the debris. But a voice, thin, panicked, called for help from inside the darkness. Talvera didn't step forward. He folded his arms, his expression composed, his voice steady when he spoke. "The structure is compromised," he said calmly. "We don't know if further collapse is imminent." A respiratory therapist stared at him. "There are patients alive in there." "I'm aware," Talvera replied. His tone didn't change. "Entering without structural clearance risks additional casualties. We cannot justify losing medical personnel or leadership inside an unstable zone." The words hung in the air. A nurse whispered, almost disbelieving, "Sir, they're trapped." Talvera met her gaze without emotion. Several of those patients were already in critical decline. Statistically, survival probability is extremely low. Silence spread through the trauma team. No one argued. No one moved. Because this was Dr. Roman Talvera, the most respected surgeon in the hospital, a man whose decisions during crises were taught in training sessions as models of clinical objectivity. He wasn't shouting, he wasn't afraid, he was simply calculating, and he had decided the risk was not worth the loss. Behind him, unnoticed at first, Noor Hadid stepped away from the wall. Her hands were shaking so badly she had to press them flat against the emergency supply cabinet before she could pull it open. Inside, trauma kits hung in neat rows. She reached for one. The zipper caught under her fingers before she forced it loose. No one stopped her. Most of the team was still staring at Talvera. Noor didn't look at him again. She slung the kit over her shoulder, moved past the cluster of frozen staff, and climbed over the first collapsed beam at the edge of the corridor. "Hey, wait!" someone called, but she was already gone. The darkness swallowed her before anyone could reach her, and inside the wreckage, the alarms kept screaming. The air inside the wreckage tasted like insulation dust and burnt plastic. Noor felt it coat the back of her throat the moment she dropped down from the broken edge of the corridor. The only light came from emergency strips along the floor and the intermittent flashes of exposed wiring that sparked overhead, throwing brief white bursts across twisted metal and shattered equipment. For a moment she stayed completely still. Not from fear, from listening. In disaster zones, no sound told you where life still existed. A ventilator alarm pulsed somewhere ahead, slow, rhythmic, its battery warning tone rising and falling like a fading heartbeat. Beneath it, she heard something else, a wet, irregular sound that came in short bursts. Bleeding. Her chest tightened. She adjusted the trauma kit strap on her shoulder and moved forward, stepping carefully between fallen ceiling panels and crushed IV poles. Every movement had to be deliberate. The floor beneath parts of the ICU had partially collapsed into the level below, leaving uneven surfaces that shifted under weight. A section of ductwork hung low enough that she had to crouch to pass beneath it. That was when she heard the first voice clearly. "Help! Please! Someone!" It came from her left. She turned and followed the sound until she reached what had once been room 12. The hospital bed had tilted sideways when part of the ceiling came down. A steel support frame lay across the lower half of it, pinning the patient beneath. A teenage boy stared up at her, his face pale under streaks of dust. A drainage tube hung loose near his chest, the insertion site exposed and dark with blood. He tried to inhale, but his breath came shallow and uneven, his ribs lifting sharply on one side. Noor recognized the pattern immediately. Air was filling the space around his lung. She dropped to her knees beside him. "It's okay," she said quietly, keeping her voice steady, even as her hands moved fast. "I'm here." His eyes darted toward her, wide with pain. "I can't breathe." "I know." She didn't waste time searching for equipment that wasn't there anymore. The original chest tube had been torn free during the collapse. The surrounding sterile dressing was gone. From the trauma kit, she pulled out a sterile, occlusive dressing and gauze, working by touch more than sight. "Listen to me," she said, leaning close so he could hear her through the alarms. "Take slow breaths. Don't fight it." He nodded weakly. Her hands moved with quiet precision as she sealed the opening temporarily, stabilizing the pressure around his lung. She didn't think about whether she had formal authorization to do it. There wasn't anyone here to give it. The boy's breathing steadied slightly, still strained, but no longer collapsing into panic. "Stay with me," she murmured. Then she heard the second alarm, louder now, more urgent. She stood immediately and followed the sound down the corridor. Room 14. The ventilator unit sat tilted at an angle beside a hospital bed, its backup battery indicator flashing red. The elderly woman attached to it lay motionless, her chest rising mechanically with each forced breath. 4 minutes remaining. Noor checked the tubing instinctively. Still connected, still functioning, but when the battery died, the machine would stop entirely. She knelt beside the bed and pulled a manual resuscitation bag from the trauma kit, attaching it carefully to the oxygen line. Her fingers tightened slightly as she checked the flow. Adequate. She removed the ventilator connection and began squeezing the bag manually, establishing a steady rhythm. 1 breath, 2, 3. Her arm would fatigue quickly. She knew that, but it would keep the woman alive. For now. The third sound came almost as an echo beneath the others. Not an alarm, not a voice. A steady, wet dripping that struck the floor in slow, rhythmic taps. She followed it until she reached the far end of the collapsed corridor. The trauma patient lay partially under a fallen IV stand, his arm twisted at an unnatural angle. The arterial line that had been inserted earlier was no longer secured. Blood flowed freely from the insertion point, pooling darkly beneath his forearm. He was unconscious. But the bleeding was strong, arterial. Noor dropped beside him. Yet her gloves slipped slightly against the slick surface of his skin as she applied direct pressure, her entire weight leaning forward to compress the artery. The bleeding slowed but didn't stop. She reached blindly into the trauma kit, pulling out clamps and gauze, securing the line as best she could under the conditions. Her breathing grew heavier now, not from fear, from the pace of decisions, from the constant calculation running silently in her mind. Which patient would fail first? Which intervention bought the most time? Which life she could realistically stabilize alone? She moved between them in a quiet circuit, sealing the boy's chest wound, squeezing the ventilator bag for the elderly woman, reinforcing the pressure, dressing on the trauma patient's arm. Time blurred. Dust settled slowly through the air. Her arms trembled from exertion, but her movements never lost precision. At one point, the teenage boy's voice broke through again, weaker now. Are they coming?" Noor paused beside him, adjusting the dressing at his chest. "Yes," she said softly. "They're coming." He swallowed hard. Don't let me fall asleep." Her gaze held his. "You won't," she said, and she meant it, because even in the dark, even with alarms fading and metal groaning overhead, she knew exactly how much time each intervention was buying. She could feel it, not in numbers, in patterns, in the rhythm of breath and pulse and blood flow that she had learned to read long before Mercy General had ever placed her name on a staff roster. Outside, somewhere beyond the collapsed corridor, she could faintly hear distant voices, rescue teams finally approaching. Inside the wreckage, Noor continued working in silence, her hands moving steadily through blood, dust, and failing light. She didn't stop, not once, because she knew that every minute she held those fragile rhythms together was another minute the patients beneath the rubble would still be alive when help finally arrived. Outside the collapsed ICU wing, the corridor had fallen into a strained, unnatural quiet. The alarms from within the wreckage still echoed faintly, distorted by debris and distance, rising and falling like distant sirens. Staff stood clustered just beyond the structural barricade. Yes, their scrubs streaked with dust from the initial evacuation, faces tight with the kind of tension that came when instinct demanded action, but authority demanded restraint. No one crossed the line. At the center of that invisible boundary stood Dr. Roman Talvera. He hadn't moved since the initial collapse. His posture remained upright, his hands folded loosely in front of him as he studied the damaged corridor. He wasn't staring into it with fear or uncertainty. His expression was focused, analytical, as if he were observing a complex surgical complication unfolding in real time. A charge nurse stepped closer to him, her voice low but urgent. "Sir." She went in. Talvera didn't ask who. He already knew. His gaze shifted briefly toward the dark opening. "That was her decision," he said calmly. "She's alone," the nurse pressed. "There are at least 7 patients still inside." Talvera's jaw tightened slightly, but his voice remained controlled. The structural integrity is unknown. Any additional personnel entering increases the risk of secondary collapse. A respiratory therapist shook his head, disbelief breaking through his usual composure. She's one nurse. She can't stabilize all of them by herself. Talvera looked at him steadily. No, he agreed. She cannot. The therapist blinked, caught off guard by the bluntness. Then we need to send a team. We cannot send a team, Talvera replied. Not without clearance from structural engineers. By the time they arrive, Talvera cut him off with a slight lift of his hand. Several of those patients were already ventilator dependent or hemodynamically unstable. Their survival probabilities were low before this incident. The words landed heavily, clinical, precise, and deeply unsettling. A younger nurse whispered under her breath, "You're talking about them like they're already gone." Talvera turned toward her. "Well, I'm talking about risk management," he said evenly. "This hospital cannot afford to lose additional staff inside an unstable zone, especially not senior personnel." Silence spread again, because everyone understood what he meant. If he entered and something happened to him, the consequences wouldn't be limited to one life. They would ripple through the hospital's surgical leadership, its accreditation, standing, its legal exposure. He wasn't speaking emotionally. Yet he was calculating institutional survival. A trauma resident shifted uncomfortably, glancing toward the darkness. "But she went in anyway," he said quietly. Talvera's eyes flicked toward him. "Yes," he replied. "She did. No judgment, no praise, just acknowledgement." Behind them, hospital administration had begun arriving. Security officers set up temporary barriers while someone spoke urgently into a phone about liability protocols and emergency documentation. Rain hammered harder against the windows now, the storm outside mirroring the tension inside the corridor. Then, faintly, a sound carried through the wreckage. A voice, calm, directing. "Slow breaths. Don't fight it. I've got you." Several staff members froze. "That's her," one nurse whispered. The voice came again, steady despite the chaos surrounding it. "Stay with me. Keep breathing." Talvera's gaze shifted toward the sound. For the first time, something like hesitation crossed his expression. Not doubt, but a brief recalculation, as if new variables had entered his mental equation. The respiratory therapist stepped closer to him. "Sir, she's stabilizing them." Talvera didn't respond immediately. Instead, he asked quietly, "How long since she entered?" 32 minutes, someone answered. 32 minutes. Inside an unstable collapse zone. Without backup, without physician supervision. The number settled heavily in the air. A senior nurse folded her arms, her voice firm now. "If she can hold them that long, we can hold this corridor." Talvera looked at her. "Structural collapse doesn't negotiate with determination," he said evenly. "If this section fails again, anyone inside will be unrecoverable." She met his gaze without backing down. "They already are, according to your calculations." The words weren't loud, but they carried. Talvera held her stare for a long moment. Then he looked back toward the dark corridor. Yes, another faint sound drifted out. This time it was weaker. A patient's voice, strained but alive. The respiratory therapist exhaled slowly. "They're still breathing." Talvera's hands tightened slightly at his sides. Not visibly enough for most to notice, but enough to signal the shift occurring inside him. Because for the first time since the collapse, his calculations were no longer theoretical. They now included a variable he hadn't accounted for. One nurse, working alone in the dark, holding multiple lives in balance far longer than probability models would have predicted. And somewhere deep in the wreckage, the steady rhythm of manual ventilation continued, a quiet, human counterpoint to the sterile logic of the corridor outside. 41 minutes after the collapse, the first structural team cleared a narrow access channel. It wasn't safe. It was survivable. Fire and rescue personnel moved through the broken corridor in deliberate formation, helmets cutting through the dust-filled dark with controlled beams of light. The air still carried the sharp smell of burnt insulation and overheated wiring. One of the firefighters called back over his shoulder, "Watch your footing. Secondary shift risk." They stepped over the same steel beam Noor had climbed earlier. The first light found her immediately. She was kneeling beside the teenage cardiac patient, one hand braced lightly at his shoulder, the other checking the seal at his chest. Her forearms were streaked with dried blood and dust, but her posture was upright and steady. She looked up when the light hit her face. Relief didn't flood her expression, only calculation. "How many?" one of the paramedics asked sharply. 3 critical in this section, Noor replied, her voice hoarse but controlled. 2 additional ventilator dependents further down. I couldn't reach them without compromising the floor. The paramedic moved closer to the boy on the bed. What's his status? Post-cardiac repair, chest tube dislodged during collapse. I sealed temporarily. Breath sounds improved on left side, but still diminished. He's conscious. The paramedic checked quickly, eyes widening slightly. Who placed this seal? Noor didn't answer the implication. I stabilized him, she said simply. Behind them, another rescuer reached the elderly woman whose ventilator had long since died. Noor was still squeezing the manual resuscitation bag with consistent rhythm. How long? He asked. 36 minutes continuous manual ventilation, she replied without pausing. He stared at her arm. It trembled faintly from exertion, but her rhythm never broke. The third rescuer knelt beside the trauma patient. Arterial bleed controlled, Noor said before he could ask. Pressure clamp secured. He's hypotensive but responsive to fluid if we can get line access. The paramedic exhaled slowly. You Jesus! Noor finally let her arm relax as the ventilator was replaced and power restored through emergency generators. The elderly woman's chest began rising mechanically again. Only then did Noor lean back against a fractured wall panel. The adrenaline that had kept her upright for nearly 3/4 of an hour began to ebb. Dr. Talvera entered moments later. He stepped carefully through the access channel, his shoes remaining largely untouched by the debris. His eyes scanned the scene quickly. The boy's oxygen saturation was climbing. The elderly woman was stabilized on a replacement ventilator. The trauma patient had a controlled dressing and functional pulse. Talvera moved closer to the boy's bedside. Who authorized intervention? He asked. The question wasn't shouted. It wasn't accusatory. It was procedural. Noor looked up at him. No one, she said quietly. Talvera studied the improvised seal at the boy's chest. Nah, you understand this exceeds nursing scope. Yes, and yet you proceeded. Yes. The paramedic nearest them straightened. With respect, doctor, he said evenly. If she hadn't, this kid wouldn't have been breathing when we arrived. Talvera didn't respond immediately. He continued scanning the area. The clamps, the manual ventilation equipment, the stabilization steps executed with precision, despite the absence of surgical tools. Nothing was chaotic. Nothing was reckless. Everything was intentional. He turned toward the trauma patient next. Blood loss estimate? 700 to 800 milliliters, Noor replied. Possibly more before control. You're certain? Yes. Her tone held no challenge, just clarity. Talvera met her eyes then. For the first time that night, there was no distance in his expression, only assessment. He had built his reputation on surgical excellence under pressure. What he was seeing now did not align with the personnel file of a second-year ICU nurse, described as hesitant during rapid response calls. It aligned with someone accustomed to making high-risk triage decisions in unstable environments. The rescue team began transferring patients one by one through the access channel. As they moved the teenage boy, he reached weakly for Noor's sleeve. Don't leave, he whispered. She leaned close. I'm right here, she said. Talvera watched the exchange without interrupting. When the final patient was secured, one of the firefighters approached him. She held 3 of them alone, he said quietly. 40+ minutes in that. Talvera nodded once. I see that. Noor tried to stand, but felt the sudden heaviness in her legs. One of the paramedics steadied her instinctively. You okay? He asked. I'm fine, she replied automatically, but her voice had softened. The mask of steady composure had begun to thin. Talvera looked at her again. There was blood on her forearms, dust tangled in her hair, and exhaustion pressing at the edges of her posture, yet her eyes were steady, not seeking validation, not defensive, simply waiting for the next instruction. For the first time since the collapse, Talvera did not speak first. He stepped aside to allow the final stretcher through, and in that small, nearly invisible movement, the balance in the corridor shifted. By morning, as the ICU collapse had moved from emergency response to formal review, structural engineers sealed off the damaged wing. Administrative teams began compiling incident reports. Risk management officers circulated quietly through staff areas with clipboards and carefully neutral expressions. The patients Noor had stabilized were alive. That fact alone altered the tone of every conversation. In the hospital's 4th floor conference suite, Dr. Roman Talvera sat at the head of a long table reviewing preliminary clinical summaries. His posture remained composed, but the calm certainty that had marked his decisions the night before had shifted into something more restrained. He wasn't defending himself. He was recalibrating. Across from him, the chief nursing officer spoke quietly. The interventions performed inside the collapse zone were beyond standard ICU nursing scope. Talvera didn't dispute that. "I'm aware," he said. "What concerns administration," she continued carefully, "is not only that they occurred, but that they were executed correctly." Talvera looked up. The wording mattered. Executed correctly meant they could not be dismissed as reckless improvisation. It meant the results were clinically defensible. The chief nursing officer slid a thin folder across the table. "Credentialing pulled her sealed personnel file early this morning." Talvera opened it. The first page listed Noor Hadid's current role: second-year ICU nurse, Mercy General, standard licensing, standard performance reviews. But beneath that was a section marked restricted. He turned the page. Field deployment records, disaster medicine rotations, international humanitarian surgical support units operating in conflict zones, certification logs documenting emergency thoracic stabilization, training under austere conditions, environments where physicians were often unavailable, and triage decisions fell to whoever had the most immediate experience. Talvera read each line slowly. No one spoke. Finally, he closed the file. "She never disclosed this during onboarding," one administrator said quietly. "It wasn't required," the chief nursing officer replied. "Her licensing met all standard criteria." Talvera leaned back slightly in his chair. "Why was it sealed?" "Because none of it fits conventional hospital credentialing categories," she said. "Well, and because she requested it remain non-public." The room fell silent. Talvera understood immediately what that meant. Those records were not academic achievements. They were operational histories, experience gained in environments where protocols were secondary to survival. A risk manager cleared his throat. "From a liability standpoint, her actions inside the collapse zone present a complex situation." Talvera looked at him. "Explain." "She exceeded defined scope," the manager said. But failure to act would likely have resulted in multiple fatalities, which would also have created liability," Talvera said evenly. The manager nodded. "Yes," another administrator spoke. "There's also the question of your decision not to authorize entry." Talvera didn't flinch. "My assessment was based on structural instability and preservation of medical leadership." No one challenged that logic, because it was defensible. But it was no longer unassailable. After a moment, the chief nursing officer spoke again. "The staff who witnessed the event have submitted consistent statements," she said. "They describe her actions as controlled, deliberate, and medically sound." Talvera's gaze dropped briefly to the closed file. When he spoke again, his voice had lost its earlier clinical detachment. "Where is she now?" "Still on duty," the nursing officer replied. "She returned to the night shift rotation." That answer hung in the room. Talvera nodded once. Then there is no further action required from her," he said quietly. The risk manager looked surprised. "No disciplinary review?" Talvera shook his head. "No." He paused, then added, in a tone that carried more weight than any formal statement, "She did exactly what the situation required." Later that afternoon, he found her in the recovery ward. Noor stood at a bedside adjusting an IV line for the teenage cardiac patient she had stabilized in the wreckage. The boy's breathing was steady now, his color stronger than it had been the night before. She didn't notice Talvera immediately. She was focused on the monitor readings. Her movements quiet and precise. When she finally turned and saw him, her posture straightened instinctively. "Doctor?" Talvera held her gaze for a moment. Then he spoke in the same calm tone he had used the night of the collapse. But this time, the words carried something different. "Your file should have been reviewed more carefully," he said. Noor didn't respond. She simply waited. Talvera nodded once. "What you did inside that ICU was not a violation of protocol," he continued quietly. "It was an exception that proved its limitations." For a moment, neither of them spoke. Then Talvera stepped back, and in doing so, he acknowledged something he rarely conceded, that authority in medicine did not always come from title, position, or hierarchy. Sometimes it came from experience no institutional credential could fully measure. In the weeks that followed, Mercy General returned to its usual rhythms. The damaged ICU wing remained sealed behind temporary walls, while structural repairs moved forward slowly. Patients were redistributed across other units. Administrators held review meetings, drafted updated safety protocols, and documented the collapse in careful, clinical language that avoided anything resembling blame. On paper, the event became an incident, a structural failure during extreme weather conditions, an emergency response executed under challenging circumstances. No one used words like hesitation or calculation or fear, but the people who had stood in that corridor the night of the collapse remembered. They remembered the sound of alarms echoing from the darkness. They remembered a single nurse climbing into it without waiting for permission, and they remembered what she brought back out. The 3 patients Noor had stabilized continued to recover. The teenage cardiac patient regained full lung function after surgical repair of his chest injury. He walked the recovery hallway within 2 weeks, his mother following close behind with quiet tears that she rarely let him see. The elderly, ventilator-dependent woman returned to her long-term respiratory unit, her vital signs stable. She often asked the nurses about the quiet young woman who had held her breath for her in the dark. The trauma patient survived as well. But his arterial injury required multiple procedures, but his circulation was restored and his neurologic outcomes remained intact. Every one of those recoveries was noted in the official review, not as extraordinary, simply as outcomes. Dr. Roman Talvera submitted his own statement to the hospital board. It was brief. He did not defend his decision in emotional terms. He explained it the way he explained every surgical judgment, through risk models, structural assessments, and institutional responsibility. But at the end of the statement, he added a single paragraph that surprised the board members reading it. He recommended a revision to the hospital's disaster response protocols. Specifically, he proposed expanding autonomous clinical authority for ICU nursing staff in situations where physician access was physically restricted. The recommendation passed unanimously. It became policy within a month. Talvera did not step down from surgery. He remained one of the hospital's most skilled and respected operators, but he voluntarily relinquished his administrative role as head of emergency response oversight, transferring that responsibility to a multidisciplinary leadership team that included senior nursing representation. He never publicly referenced why. Those who had been in the corridor that night understood. Noor returned to her usual schedule almost immediately after the incident. She declined formal recognition ceremonies offered by the hospital. She declined interviews requested by internal communications staff. When asked, she gave the same simple response. There were patients who needed care. Nothing more. 3 weeks later, during a quiet night shift, she entered the recovery room of the teenage cardiac patient for a routine check. He looked up from his monitor and smiled when he saw her. "You came back," he said. "I always do rounds," she replied gently. Well, he hesitated, then asked the question he had been holding since that night. "Were you scared in there?" Noor paused for a moment, adjusting the line at his bedside. "Yes," she said softly. "But fear isn't the part that decides what you do." He nodded slowly, as if trying to understand. She finished checking his vitals, then stepped back toward the door. The hallway outside hummed with its usual nighttime quiet, the steady rhythm of a hospital functioning the way it was designed to. Noor walked down that corridor without drawing attention, her footsteps as quiet as they had always been. And within the institutional memory of Mercy General, the collapse became one more event filed, reviewed, and archived. But for the staff who had stood at the threshold between calculation and action that night, one fact remained impossible to forget. When the system had reached its limit, the person who moved forward had not been the one with the highest authority. It had been the one who understood that sometimes the most important decisions in medicine were not about risk. They were about responsibility. What do you think about Dr. Talvera's decision that night? Was it a necessary act of leadership or a moment where calculation crossed into moral failure? Do you believe hospital hierarchy should ever override immediate rescue when lives are still within reach? And have you ever seen someone underestimated prove their strength when it mattered most? If this story stayed with you, take a moment to like the video, subscribe to the channel, and turn on the bell so you don't miss our next story. It helps more than you think. And if you know someone who works in healthcare or anyone who's ever stepped forward when others stepped back, consider sharing this with them.